Hi everyone, it's Linda McKenna from Golden Rule Senior Placement Services coming to you today with Tuesday Talks. Today being April 15th, besides Tax Day, it is National Healthcare Decisions Day. And the topic that we're going to talk about is a day for patients to make known to health professionals the kind of adequate care they wish to receive and have those wishes respected and met. So we're talking about that. I think this is great to parlay over to a lot of my clients' families, is to address it this time with your senior loved one, even if things are great with their health, or we want to make sure that when they're not able to speak for themselves, that their wishes are carried out later. And maybe that you're designated as their power of attorney or a healthcare surrogate. This certainly helps to have it legally done. May it be by an attorney, having a notary do a lot of these items is really, really important, but it to be very detailed. And some actually include all these decisions and their financial means in a trust. So that's something you should look into. And I thought no better day than actually talking about it this day that we can help you with guidance of it. Healthcare encompasses the maintenance improvement of health through prevention, diagnosis in people, and is delivered through healthcare professionals and allied health fields. Across the country, healthcare facilities and organizations that have their own physical spaces engage in these activities as well. The ones that lack physical spaces work in partnership with others as a non-healthcare versus like venues, or versus that like supermarkets, pharmacies, libraries, etc., to support this initiative. National Healthcare Decision Day is a series of independent events that's held across the country, supported by a national media and public education campaign, and was founded in 2008 by Nathan Hotkamp, a Virginia-based healthcare lawyer, to provide clear, concise, consistent information on healthcare decision-making to both the public and providers and facilities, through the widespread availability and dissemination of simple, free, and uniform tools to guide the process. Working with a lot of my clients, I make sure that this is implemented to a great degree, for the very reason is that this also helps in the placement process, that having a power of attorney involved. What are those wishes of that senior loved one now, or what it might be in the future when they can't speak for themselves? So having this is very important tool. A lot of people don't realize it doesn't have a timeline. It doesn't have a date. Everybody should have those directives, advanced directives made known. Accidents happen. It could be a car accident. It could be something that's very catastrophic. And healthcare decisions are made because by others because you didn't put your choices in place. The absence of advanced directives, medical personnel relies on family members to actually help determine what a patient's wishes might be. Family members often struggle to make these difficult decisions. However, many of these difficult decisions can be avoided with advanced planning. So like anything, it is being proactive and being preventative, so families don't squabble. This is what mom wanted, this was dad wanted, or this is what my husband wanted, if that's somebody you're telling your children as well. So how do we observe Healthcare Decisions Day? Here's a great idea and some guideline that I looked up for. It's plan ahead for your important healthcare decisions. Make an appointment with an attorney, or having that family discussion now with that loved one or for yourself, and then have it implemented with an attorney and a legal system. Find the documents you need now, complete them, and put them away where they can be easily accessible. Once you have all these documents made and actually maybe witnessed or finalized, you have to have that in a safe area. Believe it or not, it is advised to put your advance directives in your glove box of your car. So the first responders or emergency people that come to that accident, whatever that it may be, is looking for that to not only know what they're dealing with, what kind of patient that they're dealing with, but also that of what your wants and needs are. Discuss your decisions with your loved one. There's no better time to have a family conference over it. Let them know where your documents are in the event you have a healthcare event. So not only the glove box, I could speak for myself. Both of my children have it, and we also have it a place at home. So they can easily access it at any given time. Unfortunately, with even car accident or something that's catastrophic, you and your husband could be together, or you and your wife could be together. And, if one is speaking for the other and they're not able to, guess what? You have to have that secondary access to your information. Encourage other family members to complete an advance directive. Don't place the burden of these decisions on your loved ones. Use Healthcare Decisions Day to post on social media. Having worked as a director of hospice, believe it or not, when we did a lot of events out in the community, I asked that of a lot of seniors in senior development, and I asked how many people had planned for their future when they were purchasing their first home, having a child, plan for retirement, plan for entering the stock market, or anything. Everybody's hands go up. And then I asked, has anybody actually planned for the advance directives? Nobody. We were probably amongst 150 attendees, and not one actually had it in place. And we were talking about a scope of people from anywhere from 70 to about probably 85. So needless to say, this is important. It's being proactive, and it really solves a lot of pain, overwhelming effort, and disdain amongst the families that are left behind to make these decisions for you. Healthcare decisions frequently ask questions. Where can I get advance directive? Actually, there are several options for obtaining an advance directive, just like I've spoken about: a healthcare provider, an attorney or state bar association, health department, care facility for the aging. I've neglected to say that also advance directives are also left with your medical personnel. So if you have a cancer diagnosis, the oncologist will be asking you that as well because of their treatment plan. Also, maybe a primary care physician should have it. A cardiologist, if you have a very elaborate health condition when it comes to cardiology. So there is where you need to have these copies distributed to. Question: do not resuscitate or DNR is the same as advance directive? No, but a DNR can be part of the advance directive. When moving into a senior living community or going into the hospital, they're going to ask for those paperwork. Going into a senior living community that's part of the admission process, as well as in the hospital. And what we always used to call it back in the day when I worked in home health and hospice, it's on canary yellow paper. So it stands out amongst all the white papers of the document. And canary yellow paper is document is also signed off by your clinician or your medical provider. And of course, it is stamped. It is recognized, that is notarized as well. And these particular papers, it means that when there is an emergency, may it be in the senior living community or in the hospital, whatever it may be, they look towards that. If it's something that they need to resuscitate and do anything to bring you back, and knowing that that's not your wishes, they will abide by it and step away because that was your choice, and it was documented by you. Why National Healthcare Decision Day is important. It helps us to stay proactive. By making important health decisions ahead of time, this day helps us to stay on top of health situations, and the value cannot be overemphasized. 2, it saves us from bad decisions. When we apply the advice received from professionals on this day, we will be able to avoid costly errors that result in poor decisions. This will in turn lead to healthier choices. 3, it helps us get the best of treatments. With decisions about possible future health challenges being already made, patients will get the most suitable treatment in case of an eventual occurrence. This will obviously improve their chances of healing and a quick recovery. How do we observe National Healthcare Decisions Day? Learn about best practices. Make use of resources and materials to help you think through your healthcare wishes. You could check out Conversations Starter Guide and a guide to being a healthcare proxy. 2, make adequate plans for your healthcare decisions. Healthcare decisions should not be just the end of life issues. It should include mental health issues, blood transfusions, amputations, and when the affected person is incapable of making sound decisions. If somebody does have a dementia or Alzheimer diagnosis or mental issues, unfortunately, they're not able to verbally make those decisions at that period of time. So what was written in the past will be abided by. 3, encourage others to do likewise. Educate and encourage other people on the importance of making healthcare decisions in time. You could be saving a life by doing so. I can't say this as much. I'm, working with these individuals through home health and hospice. We've had all this part of our records when we triage our patients and took care of them. Now that I work in senior placement, this is just my know-how, that knowing how important this is when placing somebody, that this all needs to be constructed, decided upon, because the senior living community is going to ask that of you as well. And honestly, it's being proactive. I have a lot of resources for my clients that work with me, and bringing them to the proper people and the channels to get this accomplished. Like I said, lawyers, may be that it is notaries, but I think the best way of getting all the T's crossed and I's dotted and a family decision all together is having a family law, elder care, an attorney to do that for you. No better way of getting it accomplished. And guess what? You'll never have guilt. You being the family member that's left behind won't have the burden of guilt of making the wrong decision for the loved one in times of need. You're just carrying it out. There's no way better than being that guardian angel for your loved one when they can't make those decisions themselves. So do it. Don't wait. Make that a late New Year's resolution. Make it happen now. Why wait till it's imminent? Do it now. The youngest of people actually make these decisions. So it doesn't have to have a specific date in mind or age in mind. Next week, we're going to be talking about this being Parkinson's Awareness Month. What should you know about Parkinson's disease, and what assistance can you give for your senior loved one? Again, I always leave you to my website. It is www.goldenruleseniorplacement.com. There you will find my demographics, how to get in touch with me, also my bio, testimonials, the various options that are out there in senior living, resources, and a whole library of all these video talks on all different subject matter. By all means, if you want to drop me a note, please do so. There's links to my social media as well too, that you could become acquainted with me that way as well. I look forward to assisting you and your senior loved one on this journey. It does take a village, and having somebody guide you through an overwhelming time really does have an impact on you and that senior loved one as well. Thank you for viewing Tuesday Talks with Linda McKenna, and I wish you a blessed week, and I look forward to seeing you next week. Bye-bye now.